is Mara. So today I wanted to do a video on a couple key terms, vocabulary words I guess, and sayings that is necessary to know in the medical field, especially if you work in a lab, if you're a phlebotomist, or if you're a medical laboratory scientist like myself who also does patient care, has some patient contact. So the first one, when you would greet a patient, I have outpatients, so sometimes I have to tell them it's going to be a little bit because I have to look up their orders in the computer, or I have to manually enter in their orders. So first of all, I would say, ¿Cómo estás hoy? And that is, how are you doing today? And then I might say, la espera será corta, which would mean the wait will be short. So just going to be a few minutes. I'm going to go back and put this in the computer, but without saying all of that. So the next thing, when I would bring them back into the room, or if I was going into a patient's room, I could say, my name is Mara and I'm a medical laboratory scientist. Or you can say your name and I'm a phlebotomist. So that would be me llamo, or I am called, so me llamo Mara y yo soy un científico de laboratorio médico. Or soy un técnico de laboratorio médico, which would be like a medical laboratory technician, or MLT. Or yo soy un phlebotomista, which I'm a phlebotomist, or soy una enfermera, which is I am a nurse. So you kind of, when you introduce yourself, you want to say what your job is so they know kind of what you're doing. Being a medical laboratory scientist, we get confused with nurses a lot, with phlebotomists a lot, because we do kind of have some of the same jobs. So it kind of helps them know, sets up the scene, what you're going to do. Or, you know, sometimes I just come in and say I'm a phlebotomist, you know, because they don't really need to know my whole background. It's just easier because most everybody knows a phlebotomist draws your blood, so that makes it a little bit easier. They know what to expect from you. Next thing, let's see. So you want to verify you have the correct patient. So one thing you could say is, ¿Cuál es su nombre completa y fecha de nacimiento? Which means, what is your complete name, your full name, and what is your birth date? So what is your date of birth? So you want to have at least two identifiers, identification numbers, their name, their birth date, or, you know, and then also check their arm bracelet if they have one of those on to make sure it matches with your paperwork, so you know you're going to stick the right patient, or, you know, do the right care to the patient that you're supposed to if you're a nurse. So a few vocab words. So one of those would be sangre, which is blood, so that's important, being a phlebotomist or a med tech, knowing blood. So sangre, you kind of think of like sangria, which is kind of where that comes from, blood, wine, bloody drink. Another one is orina, which would be urine. So if you have to collect a urine specimen from somebody, then you could let them know that that's on their order. They have, you know, orders to get a urine collection. Another one is, that would be vein. I guess it'd be la vena. And, you know, so if you're telling them you're going to stick a vein, so you want to tell them, you know, you're going to look for a vein, so it'd be la vena. Then another one you could possibly use would be Lamagno, which is the hand. And some people are really hard sticks, hard to get blood drawn, and so you might need to draw a vein in their hand. So then you would say, you know, can I have your hand, or something like that. Or, well, I'll get how you would say that next. Another one would be el brazo, which is arm. So if you're looking for la vena in el brazo, then you would, you know, kind of know where you're going to touch them so they don't feel uncomfortable and they know, you know, to put out their arm. And another one, which is not going to happen as much, but still important, is if you need a stool sample. So I found a couple definitions for that one. Basically, excremento, and that one is, for stool, so it's like excrement. I think it's trying to, instead of saying like caca or whatever, it's another alternative to poop, because they're like, oh, we're going to get a poop sample. It doesn't sound as, nice. And then another vocabulary word is el laboratorio, which would be the lab. So you could say, me llamo Mara, soy de el laboratorio. So my name is Mara, and I am from the lab. Then another one, like I said earlier about, their arm or their hand, you can say, I need to see your hand or your arm. So you would say, necesito ver su mano, su brazo, or sus venas. I need to see your veins. So when you're going to draw them. Another one, if you're going to, maybe right when you come into the room, you say you need to get a sample of blood, then you say necesitamos, we need una muestra, and that's like a sample day, and then you could say orina for urine, sangre for blood, excremento for stool. So we need a sample of blood, urine, stool, whatever kind of sample that you're needing. And then, especially for our little niños, if you have children that come in and they may understand Spanish, but they don't understand English, and a lot of them are really excited, or once they got done bawling their eyes out after getting drawn, they're always excited about stickers. So I looked this one up, and it says how to say, would you like a sticker? ¿Quieres una pegatina? And so that's, would you like a sticker? So they're always excited about it. I've had ones come in like bawling their eyes out after I've drawn their blood, little ones. And then I'm like, oh, I'm sorry, but would you like a sticker? And then their eyes like light up and they're so excited. So that's usually something to kind of end on a good note. They want a sticker. Or if at your location you guys have like little stuffed animals, sometimes I know if it's bad they give like a little teddy bear or something, or stickers or some little treat. If it's okay with their parents, you can ask them if it's okay, if they can have it, and then give them a sticker. Usually they're so excited, like Nemo or whatever kind of stickers you have. Bugs Bunny. And then the last thing is gracias por su paciencia hoy. Thank you for your patience today. So that you just kind of want to, especially if you took a while getting their orders, or if there was a couple of people in front of them and you had to wait, or they came in through the ER and you knew that they were waiting on lab results, and you had to go draw someone else, or just any time that you think there was an extended amount of time that they had to wait. You want to thank them for being patient with you. Also, especially if you had to stick them more than once, you couldn't get the first draw, you had to call somebody else in to see if they could draw them. You want to thank them for being patient, so they, that's something that you want to convey, that you're appreciative that they weren't like all huffy and everything. I mean, even if they were, you still probably want to say it like, thank you for coming in, thank you for your patience. Yeah. So that's just a few things. See what you guys thought. If that was how, I hope I said everything right. My Spanish minor kind of like is long gone, and I need to refresh. And I think it's really great. Where I work, we have a high population of Hispanic people, and usually they come in with a significant other or another family member who understands English for the most part, and they're kind of the translator. But we've also had patients come in who especially the ER doctor has to get a translator, and they can do it through like Skype, which is pretty cool, and they can translate everything back and forth. So, but it's really important in any area to kind of be bilingual and at least be able enough that you can communicate what kind of care you're going to give to the patient. So, thanks for watching. Bye, guys.